Did you know that today Big Pharma profits over $400 billion a year while more and more Americans suffer living off of daily medications instead of finding true healing? In this episode, I'm going to explore and blow your mind with the deep connections that people like Anthony Fauci, Bill Gates, and others have, and the number of deaths they've caused, and also go through what you need to do instead to heal. If you want to reverse diabetes, if you want to reverse low fatigue, if you want to reverse high blood pressure, we'll start getting into what you can do instead of these conventional medications, that and so much more on today's episode. Welcome to the Dr. Josh Axe Show. So if you want to know what one of the biggest turning points was in all of medicine, it was in 1910 when the Flexner Report was commissioned by the Carnegie Foundation and pushed heavily by J.D. Rockefeller. He radically transformed American medicine for the worse. And Rockefeller, who made his fortune in oil, sought to dominate the new pharmaceutical industry built on petrochemicals. Now, the Flexner Report discredited most natural healing schools. In fact, did you know in this report, the goal of J.D. Rockefeller was to put chiropractic, homeopathy, naturopathy, and herbalism completely out of business? He actually wanted to ban them completely and make them illegal. In fact, did you know that there were chiropractors and naturopaths who went to jail because some of the laws that J.D. Rockefeller were trying to pass? The goal of the Flexner Report, and by the way, I'm going to dive into this some now, but you could check this out later, looking up the Flexner Report, what it was all about. But basically the goal was this. It was to make people that were nutritionists, that were chiropractors, that were herbalists, people that practice natural medicine, to make them seem unscientific. And he pressured licensing boards to only approve what he called scientific schools focused on drug-based treatment, because J.D. Rockefeller could only benefit financially from synthetic pharmaceutical drugs, and he couldn't benefit from somebody prescribing turmeric or lavender or homeopathic treatments or chiropractic treatments. He couldn't benefit from that. So this turned mainstream medicine into a drug-first, symptom-focused system and really marginalized natural healing therapies and doctors for over a century. The pharmaceutical industry is now expected to be worth $1.21 trillion globally. That's in the U.S. alone. And Big Pharma profits top $400 billion a year, outpacing nearly every other industry. Now, also, of course, up there is big agricultural companies, big tech, and big chemical. But these organizations as a whole, their goal is not to heal people. It's not even to help people. It's to turn a profit. And if people understood and knew deep down the way that these organizations developed and how they were birthed. Again, looking at the mainstream medicine, this drug industry today, J.D. Rockefeller said, I want to make money. That's a single goal. I want to make money just like I did in this other industry. I want to make money. Then I think more people would question mainstream medicine and would look for natural approaches. It's estimated that $200 billion per year is spent in the U.S. on unnecessary and improper use of medications, such as those taken prematurely, too often, or when not needed, or to counter affect the side effects of another drug. One example of this we know are antibiotics. In fact, some doctors have stated that antibiotics are overprescribed anywhere from over 50% up to possibly even 95 to 98% of the time they shouldn't be prescribed, yet they are. Again, kids' ear infections is an example. That's a viral infection, but we prescribed antibiotics for it. Doctors should be having their licenses suspended for those sorts of things. It's malpractice, yet it's become the norm in the United States and in other Western countries. And I think, again, it's so important to understand where these things have come from. This is one of the reasons why I so respect the Bible and biblical medicine. I also respect Chinese medicine, Ayurvedic medicine, Greek medicine. When you read about some of the physicians out there, biblical medicine, or someone like Maimonides, who was a Jewish physician. When you look at, of course, the teachings of Jesus, there is such virtue and care and a morality and ethical, strong ethics attached to those, that it was done in good reason and for a good purpose. When you look at the way that Chinese medicine doctors treated people and the care they went into creating the system they created, there's a level of ethics there. And the same with Greek medicine. When you read the writings of everyone from, even Plato and Aristotle to people like Hippocrates, there's a level of ethics there. When you look at the medical industry in the United States, it was founded unethically in nature in terms of what its essence is, which is profit off of people. So again, I want you to understand this. The main goal of the pharmaceutical industry and of our American Medical Association is not to heal people. It's to make money first. And some of the people that have most benefited, I want to go through some of these people. Number one is Bill Gates. His organizations like the Gates Foundation, GAVA, which is a vaccine alliance, and the World Health Organization, these organizations he has been a big part of, they have really, really tight financial ties to Pfizer, BioNTech, CureVac, which is a vaccine industry. This money he raises, which again, by the way, it's not his own money. He's going around raising money from other people, okay? He's then putting them into vaccines, biotech, and drugs, which he then has other organizations which benefits from it, and it benefits his reputation, his connections, a number of things. So anyone thinking that Bill Gates is doing this stuff out of pure altruism is absolutely incorrect. He is indirectly profiting through increased stock valuations and policy sharing. And so, again, he has probably more than anybody today influenced the vaccine industry, which, again, he is first and foremost somebody who's trying to make money for himself and gain a certain level of power. We saw this where even when coming out of COVID, we knew that certain things were false and unable to be true. He is saying things like, well, when the next pandemic comes around, we need to make sure that we have even more vaccines. Why is he pushing for us to have hundreds and hundreds of vaccines? We've also seen Bill Gates test these vaccines on third world countries in areas like Africa. And he's okay with the damage done to those people because we won't likely hear about it here in Western countries. One of the biggest criticisms, they call what he does philanthrocapitalism. And it's investing in companies he later donates to under the guise of charity. Okay, so there's this sort of level of deception going on. Another person who has had deep financial ties to the pharmaceutical industry is Dr. Anthony Fauci. His organizations controlled and influenced the NIH and NIAID. He had close financial ties. In fact, the NIH co-owns the patent for spike protein used in Moderna's vaccines, and he's received royalties from pharma patents, amounts that have not been fully disclosed. So we don't know exactly how much he's made from it. Of course, he had a salary making over $400,000 a year, but more than that, there are personal royalties he's been paid via making more money off of things, vaccines, COVID, of course, HIV in the past, and a number of other things. And there are other people like Albert Bourla, who is the CEO of Pfizer, who we've seen making money. We see Klaus Schwab, of course, from the World Economic Forum, and just sort of how he's been the global architect of this centralized control system like vaccine passports. Right? So he is, in a way, making money off of them, even if it's not directly the drug itself or the vaccine itself. And then Stefan Bancel, he's the CEO of Moderna. Again, big ties there to the mRNA. We see his personal net worth at over $12 billion. Being tied to these pharmaceuticals and vaccines. And so it's important to understand where this industry came from so you can know the truth of it. Again, when I look at biblical medicine, what the Bible teaches, it's absolutely 100% true in terms of what I've seen with patients and the promises it makes. When I look at Chinese medicine and Ayurveda, these are medical institutions and medical philosophies and systems that have been around for around 3,000 years. They've been proven by millions of individual case studies that were not funded by a pharmaceutical company. They were just created because doctors wanted to help people. Very same thing in Greek medicine, those philosophical ideas were Hippocrates, like recommending people practice sunbathing and fasting and eating certain foods for healing and taking certain herbs. This was all done strictly to help patients heal. Our pharmaceutical industry and our medical industry today was not founded on those things. It was not founded on healing. It was founded on making money. Listen to this. Americans take more pills today than any other time in recent history. In fact, around nearly 70% of U.S. adults take at least one prescription drug a month. Think about that. 70% of people of all ages take a prescription drug. And listen to this. If you're 65 years or older, that's 90%. So only 1 in 10 people over 65 aren't taking a drug. And listen to this crazy stat. 1 in 4 people take 4 or more medications, and 22% take 5 or more medications at a time. I can remember my grandmother, okay? My grandmother had started taking high blood pressure medication. And then she took cholesterol medication. And then she took a blood thinner. And at one point, my grandmother was taking, I want to say it was like 18 medications. I'm not kidding at one point. This is probably 20 years ago when she was in her 70s, but she was taking that many medications. And I remember thinking, this is just absolutely insane. You could just see her just getting more and more feeble and more sick. And so I experienced this firsthand, and I was always blown away in my medical practice at how many patients would come in on not one drug, but oftentimes they were just on a drug to take care of the side effect of the other drug they were on. And so, we know this is that these drugs all have side effects. And the thing you need to know about drugs are they're synthetic. There's not a single drug that doesn't have a severe side effect. And listen to some of these other stats. 1 in 6 children between the ages of 6 and 17 is diagnosed with a mental health disorder. 1 in 6. 11% of American children have been diagnosed with ADHD. 20% of boys that are in their teens. So 1 in 5 have ADHD. It's absolutely crazy. And the amount of medications kids are taking for this. By the way, 25% of middle schoolers and high schoolers report taking stimulants and ADHD drugs at some point, even if it wasn't their own prescription. I remember this when I went to college, when I was an undergrad. People were taking Ritalin and Adderall for every final exam, every midterm paper. On a regular basis, even if they didn't have the diagnosis. Some of them would go in and just say, "I'm having trouble learning," and their doctor would just say, "Okay, there you go. There's a prescription for ADHD," and they would take these drugs. And this is happening far, far more than most people realize. We see this with numerous drugs, whether it be antidepressants. Here's another crazy stat. 65% of women between the ages of 15 and 44 use some type of contraceptive drug, whether it be a hormonal birth control pill, injections, or sterilization. That 65%. And contraceptive drugs have been linked to hypothyroidism. They've been linked to autoimmune disease and a number of other health issues, candida overgrowth, getting chronic infections. And so most women think, I'm taking a contraceptive drug. It's not really a drug. It's like it just keeps me from getting pregnant. No, it's a drug that has major side effects, and you'll pay the price later on. Originally, pharmaceuticals were intended for short-term or life-saving interventions like treating infections or surgery. Okay, that's what they were intended for. Okay, you come down with pneumonia, or you lose a limb or have a major infection that's where your life is at risk. Okay, or you have to undergo surgery. So they were meant to be taken between 1 day and 2 weeks. Okay, in most cases. Well, we've taken this acute medical care and pharmaceutical care, and rather than taking a pill for a day or even for a month, we're told that we have to be on these drugs the rest of our life. Do you know most people, when they get on a drug, they're on that drug the rest of their life, or at least a lot of drugs, whether it be a blood pressure drug, a statin drug, antidepressants, Of course, diabetes drugs like metformin, most of these drugs people take the rest of their life. And then doctors tell them you have to be on this drug the rest of your life. There's no reversing that because you have bad genes. We know today the studies show 95% of your illness is lifestyle related. Only 5% or less is genetic. Genes have to be switched on. Now, I just mentioned this. The number of people taking multiple medications is extremely high. 25% of people are taking 4 or more medications, and 22% 5 or more medications. It's called polypharmacy. It's taking multiple medications. This leads to more and more side effects, higher healthcare costs. And then here's the other issue. Drug interactions and side effects are the cause of nearly 30% of hospital visits in older adults. So think about that. 30% of the time somebody gets admitted to the hospital. 1/3 of hospital beds today are filled with why? Because a drug interaction that they were having with another drug or the drug side effects. If you really stop and think about that, 1/3 or 30% of hospital visits today in older adults are due to the interactions or side effects of drugs. Think about how much we would save if people would switch to an herb instead of a drug because you're not going to have those same side effects. We would be saving billions, actually more likely trillions of dollars. And the numbers are just continuing to grow. In fact, a lot of people think the numbers could almost double by 2060 in terms of the number of people that are hospitalized due to these medications. And many of these symptoms, as I mentioned, can be treated. Of course, I mentioned supplements and herbs, but also even more so through diet, through lifestyle, through more holistic treatments, mind-body practices. The body can heal without drugs. In fact, if you're sick, it's not because you have a drug deficiency. It's not because you don't have enough aspirin in your system. That's not why you're sick. There's another root cause going on. And if you don't ever get to the root cause, you'll never fully be well. In fact, it's just masking things and you'll get sicker and sicker over time. And so here's one of the other massive, massive problems. I'll put this near the very, very top of the problems. Overdiagnosis. Here's what it is. Overdiagnosing is diagnosing a condition that, if left untreated, would not cause any problems or symptoms during a person's lifetime. Okay? An example of this is normal variations of human experience like sadness or inattention or aging or fatigue are now labeled as disorders that need treatment like drugs or therapy. And I think about my wife, Chelsea, and after having a kid, you're going to have some postpartum depression. When I was a kid, I had some inattentiveness. I did. But we're great now, and we did it without drugs. You don't have to have drugs. Drugs only make you worse. They might make you feel better, but you actually physically are getting sicker. We see this with so many conditions like mild cognitive impairment, subclinical depression, prediabetes, ADHD. Here's the problem. More diagnoses equal more prescriptions, equal more big pharma profits, which they can pour more into manipulating research, which increases your risk of side effects. It's a sort of vicious cycle that happens, or this vicious cascade. One of the other major issues is that when people have a medical condition, oftentimes they feel like a pharmaceutical is the only thing they can turn to. And it keeps them from feeling like they can make a lifestyle change and reverse things. I mean, diabetes is probably the biggest example of this I can think of. If somebody were diagnosed with diabetes and their doctor told them, listen, in order to heal, here's what you got to do. We got to change your diet. We got to get more low glycemic there, less glycemic load. Let's do more low glycemic fruit, way more vegetables, way more organic meat. Let's increase your protein, your fiber, your healthy fats. Let's take a few supplements. Let's just add more cinnamon to your food. Let's maybe take some chromium and berberine, just those two things. Hey, let's do that. And I want you to move a little bit more. Just go on more daily walks. Almost every time, type 2 diabetes will be reversed. But when they go into the doctor, they're told, just take this pill. And then because they have diabetes and everything isn't fixed, they end up with nerve degeneration. They end up gaining more weight. They end up having, have vitamin B12 depletion, so lower energy. They end up actually being worse long term because of our system. The reality is this, the way that everything should work is our pharmaceutical industry should shrink by about 95%. And pretty much the drugs that should be given should be for emergencies only. If somebody is going into surgery and we have to save their life. But that's really almost the only time if somebody needs life-saving care when we should be using pharmaceuticals. And in the case of diabetes, almost every person, I would say over 90%, if they just follow the diet, supplementation, and these other things we've talked about, they will reverse their condition. In fact, it's probably close to 98% of the time. And by the way, prove me I'm wrong. Send me somebody with type 2 diabetes, okay? In fact, I would actually put this to the test with almost any doctor out there, if they'd like to do this. If you've practiced conventional medicine, you have the person, we could do a control study where they follow your way of taking metformin, whatever drug it is. And if you have a type 2 diabetic come and see me, we could have, 10 patients. I think at least 9 out of 10, if not 10 out of 10, if they follow what we lay out in these recommendations. And even if they don't follow it perfectly, even if they follow it at 50% or 25%, they will be much better off under my care or the care of somebody who practices like what I'm sharing, this functional medicine, this holistic medicine, in 1 year, 5 years, and 25 years than in the conventional medical system. And this is why I am so excited about people like Robert F. Kennedy Jr., Marty Makery, Casey Means, and so many others who are now on the grand floor making these changes in the government. This is really the first time ever we have had government officials that are altruistic and pro-natural medicine, that aren't trying to profit themselves while they're doing these roles. The first time, I think, at least in my lifetime, but I really believe it's about the first time in history where the people over medicine have that sort of heart and that intent. Have you ever had your car's engine light come on, only to have the mechanic say, hey, everything looks fine? That's what it feels like when your labs come back normal, but you still feel off. Maybe you're exhausted, you're foggy, you're moody, you have these unexplainable symptoms, like your body's trying to tell you something, but nobody's listening. Most blood work is like popping the hood and glancing around. It might catch something really obvious, but it's not looking at the engine or inside the engine. And your engine, that's like your cells. That's where real healing starts, at the cellular level. Because if your cells are stressed, inflamed, or hormone resistant, your body can't do what it's designed to do, no matter how normal your labs look. Listen, if you're tired of feeling like something's wrong, but no one can explain what, go to beyondbloodwork.com and find out what your cells are trying to really say. I want you to take a listen to this clip from the head of the FDA, Marty Makery. He explains the employees of big pharma companies actually sit on FDA advisory committees and what he plans to do about it.
We are removing industry members, pharma members, from FDA advisory committees. I was shocked when I learned that employees of big pharma companies sit on FDA advisory committees as members of those committees. So we're going to be replacing them whenever statutorily possible with patients and family caregivers. We are going to be inviting pharma companies to send representatives to the advisory committees, but they can sit with the rest of the public and watch and pose questions as the rest of the American public.
And you can see here, it is absolutely crazy that you have this connection between big pharma where they can sit on the board of the FDA basically dictating what we do. I mean, this is why food dyes have stayed in medications and in our food supply so long, these petrochemical food dyes that are toxic to our bodies because this very reason. And so it's important. It's so funny. I mean, did you know in this Flexner report, and there were other reports around that time, they said we're going to start using the word conspiracy theory to discredit people who are trying to discredit us. It was part of the propaganda warfare. So when you see these people saying, oh, you're a conspiracy theorist, it was actually a propaganda tactic like used by the Nazis in the time of Hitler. We saw it used really in a pretty profound way. Then it's used in the very same way by pharmaceutical company execs in the medical industry in certain areas of the government to discredit people who obviously saw the dust. We saw this happen during COVID. I mean, how many of you were sitting there during COVID and you could see, it's like we pulled back the curtain and we saw what was going on. You saw what Dr. Fauci was doing. You saw what Bill Gates was doing. You saw what people at the World Health Organization was doing, Klaus Schwab, and you were sitting there and you saw, why isn't everybody seeing this? Oftentimes it's laziness, or we don't want to see it, or oftentimes people just want to be popular. And so they want to go along with the main narrative. And because they feel like, well, if I just go along with the crowd, that means I'll be right. But typically what leaders do is sometimes they stand alone. Sometimes they pioneer things, go off by themselves. People follow. My point there was it really took courage for people to stand up to say, I'm not going to just go along with this narrative when it's obviously a lie. But listen, there's a bigger narrative going on. That narrative during COVID, that same narrative has been going on since 1910 at the very least. Okay, we're talking about over 100 years. This same narrative has been trying to put chiropractors out of business, naturopaths out of business, nutritionists out of business, functional medicine doctors, discredit them. We're talking about what happens is you have these pharmaceutical companies, and they pay doctors things like kickbacks, and they created the schools to educate the actual doctors, or at least, put all the money into them. And so you've got this sort of these doctors that are educated by the pharmaceutical industry, and then oftentimes then they go and sit on government boards. And so everybody's sort of in the same sort of family of trying to protect each other and take advantage of people that are vulnerable, the sick. Okay, that's what's happening today. And the reality is that you need to be able to see this bigger thing that's going on. Here's the other thing you need to know, and this is really interesting. Big Pharma also contributes to millions of dollars towards presidential campaigns, both Democrats and Republicans. We see them infiltrating every area in every industry. Now, I want to take a moment and go through the proof of how deceptive these pharmaceutical companies are and what we see. And by the way, again, this isn't only the pharmaceutical company. We see a very similar playbook with food companies. The tobacco giant R.J. Reynolds pivoted to junk food after tobacco sales plummeted. They bought companies like Nabisco for nearly $5 billion. So we see these same tactics used in, again, big tech and big agricultural companies as well. Now take a listen to this of proof of how evil these companies are. I want to go through the top 5 big pharmaceutical lawsuits by settlement amount. And by the way, this is only 5. There are hundreds, but here's the top 5. Purdue Pharmaceuticals had to pay out over $6 billion for misleading marketing of OxyContin, its addiction risks, and it killing so many people and fueling this opioid crisis. Okay, we're talking about $6 billion in lawsuits. Now, here's the thing. They made tens of billions or hundreds of billions off of this, probably hundreds of billions. So for them, paying out $6 billion, that's just part of their marketing budget or their legal budget, just to pay out. I mean, they still made more. But again, these drugs, again, this opioid crisis, the pharmaceutical company knew how addictive it was, and yet they didn't say anything. They covered it up. They paid out $6 billion. Johnson & Johnson, right? Johnson & Johnson has been known as this sort of like, I recently had an expert on about this and him talking about the Johnson & Johnson Pfizer vaccine and some of the other things they've done. They were known for, these baby commercials where they've sort of this gentle soap for babies' eyes. They paid out over $5 billion recently for their role in the opioid crisis failure to warn of talcum powder and also cancer risk. So Johnson & Johnson, very similar thing, $5 billion. Here's another one, GlaxoSmithKline, $3 billion in lawsuits for fraudulent marking and suppressing data on the side effects of their drug, Avandia. Tens of thousands of people died of cardiovascular events. Tens of thousands of people died, and it's only $3 billion. It actually should be a lot more than that. False marketing claims. So we see that they lied and they lied and they lied. So they're constantly lying and covering up. Listen, this isn't one pharmaceutical company. This is every single one. Here's another one. Pfizer paying out $2.3 billion for promoting drugs for off-label use and giving doctors kickbacks for doing so. This caused numerous injuries and deaths. And then here's another one. And by the way, how often does this happen? I mean, birth control originally was prescribed for women who wanted to not get pregnant. It's a terrible drug with terrible side effects. But then they started prescribing it for off-label uses like acne. And then I was actually had Allie Beth Stuckey on the show, and she said, well, for myself, they just told me it would be good for my hormones. Type of condition is that? Good for hormones for a 17-year-old to be on with birth control? So that's just an example, and there are so many others like this. Okay, and here's another one, Merck. This is one of the most devastating. $4.85 billion, so nearly $5 billion in payouts. Merck created a drug called Vioxx. In their data, they concealed multiple papers and studies showing it was causing heart attacks. Did you know there are some estimates? They said at least tens of thousands, but many people believe anywhere from 60 to 100,000 people died as a result of taking the drug Vioxx. Think about that. 100,000 people, or at least 60,000 people, died from taking this one single drug. Their hearts were exploding, causing strokes, major heart attacks. And they only paid out $4.85 billion. I mean, if you actually do the math, it should be so much more than that. And it's not just about the payout, it's just the lies and the deceit. If companies have this level of deception, there should be a bigger ban than just the money being paid out. Those people that are part of those companies should be thrown in jail. They should be losing their licenses, and they should not be allowed to be involved in the industry again. But you'll see as those people will just switch companies and go work for another pharmaceutical company, and they never really get penalized for it, or one person takes all the blame when there were hundreds involved in the lies and the deception. So as you can see, the pharmaceutical companies, which then educate the doctors, they don't care about you. They only care about making money. In fact, if they killed millions of people, which they have, they don't care because they made money. Now, here's another connection you have to be aware of if you really want to understand what's going on. There is a deep connection between not only the pharmaceutical industry and the medical industry, but the pharmaceutical industry and the food industry. About 80% of chronic diseases and premature deaths are thought to be potentially preventable through diet and lifestyle. Okay? Diet. Processed foods in a sedentary lifestyle lead to conditions like obesity, diabetes, heart disease, autoimmune disease, gut dysfunction. Sick people then need more drugs to manage the high blood pressure, the high blood sugar, the depression, the acid reflux, the high cholesterol. Meanwhile, ultra-processed food companies are often owned or heavily invested in by pharmaceutical conglomerates. So think about this. You have the same people and investors that own the pharmaceutical brand like Merck and Pfizer, and also own the food companies like Hershey's and Nestle and, name your company, General Mills. And so they're okay with keeping all this sugar and cereal and the food dyes and all the things that make us sick, because then they're going to go and take more pharmaceuticals. And if you think for a second, no, people couldn't be that evil. There's no way that a person is smart enough to go and own both a pharmaceutical company and a food company, and they're okay if these things are making them sick, or even they engineer it or strategize it that way. You're absolutely crazy if you think that that's not part of the intent, and if people aren't aware of that. Here's the reality. If you want to be well, one of the greatest tools in your tool belt is awareness. Being aware, being able to connect the dots, see the patterns. I love Jordan Peterson. One of the way his definitions of wisdom is being able to see all the dots, connect all the patterns, and see through the lies. That is a form of wisdom. And if you want to be wise, you can't just continue to go along with the narrative. You have to be able to think for yourself. You need to be able to have a discerning heart and spirit. The Bible talks about this. We should have a discerning heart and spirit and be able to find the truth. Part of wisdom is being committed to and actually being able to find the truth. And then even if the entire crowd, everyone else is going in the other direction, you have enough wisdom and courage to go towards what's right. Not what's popular, but what's right. If you want to be health and find the truth, here's what you need to know. Modern medicine today just isolates the symptoms in one organ group. They ignore the root causes like trauma, loneliness, nutrient depletion, and disconnection from nature and movement. As emotional and spiritual needs continue to go unmet, prescriptions for antidepressants, sleep aids, and anti-anxiety medications, they just keep rising. Example of this is loneliness is now considered a public health epidemic, raising mortality risk by up to 45%. It's the equivalent of smoking 15 cigarettes a day. And what doctors do today, rather than connecting people, is they say, here's an antidepressant. That's the solution. What functional medicine does is it seeks to find the root cause of poor health instead of just managing symptoms. Now, typically a doctor can find out what's going on just looking at the symptoms. But also there are ancient forms of testing, like in Chinese medicine, they could feel your pulse and look at your tongue, do tongue mapping. And today in Western medicine, we're able to look at, do a gut microbiome test, like a GI map. We can do a CRP, which is a high sensitivity inflammation panel of your cells. We can look at your organ age. We can do micronutrient tests, fatty acid testing. We can know every vitamin and mineral and amino acid you're deficient in. We can look at hormone panels. There's a number of things we can look at and then prescribe and recommend lifestyle changes, herbs and supplements, certain foods, types of movement, and certain types of human connection for healing. And another big difference between this pharmaceutical approach and this truly healing approach is one has a one-size-fits-all approach. Here's one drug for 100,000 people. Whereas when you look at this cellular personalized medicine or functional medicine, it's more, I'm going to look at your unique biology and the way God uniquely made you and customize something just for you. I can say this. I have almost never, when I'm working with a patient one-on-one, given them the exact same thing as somebody else. It's typically a little bit different. Or at the very least, when I'm working with somebody in a full-on program, I'm still doing a level of customization. For instance, if someone has type 2 diabetes, there are a lot of the same therapies and foods and diet that work for that person. At the same time, encouraging them to be aware because certain things will work more for other people. I'll give you an example. I had one patient with diabetes, type 2 diabetes, and I just had her make little changes. I said, listen, let's just add more meat and vegetables in your diet. And then I want you to start adding in a teaspoon of pumpkin pie spice into your morning smoothie. She came back to me 28 days later, 4 weeks later on the dot. And she said, Dr. Axe, it's the craziest thing. She said, my blood sugars dropped so much, I stopped taking my metformin, my diabetes drugs. I had another drug. I got off that too. She said, both drugs I got off of, my blood sugar is 100% in normal range now. And I said, did you do what I asked you? She said, yeah. She said, the only difference between me doing what you asked me is, she said, rather than using 1 teaspoon of pumpkin pie spice, which is really high in cinnamon, which is good for diabetes, she said, I started using 2 a day. And I said, great job. That was it. So there are little things like that, literally adding cinnamon, just eating a little bit more meat and vegetables. And some people could just reverse type 2 diabetes, making those simple changes. She started maybe walking more as well. And that was it. That was it. And yet today, these pharmaceutical companies are making money by actually making people more ill, and giving them this drug is actually taking years off their life. I want to walk you through some examples of healing naturally without prescription. I just hit on type 2 diabetes there. Another one is anxiety. Exercise in some studies have been shown to be more effective than anti-anxiety medications, okay? More mindfulness practices, reading your Bible, focusing on gut health, taking SAMe and vitamin D every day, getting just more natural sunlight. This can reverse anxiety in most cases. Not 100%, but most. And if it's not that, typically going and actually dealing with the childhood trauma. Some of these drugs, they actually keep you from going and addressing the root of your issues. So if somebody has childhood trauma and you simply go and numb them with a medication, their life is not any better, okay? You've just slowed down them actually being able to live their optimal life. Resolving autoimmune disease, here's another one, through following a GAPS diet or AIP diet, or a diet that's very high in bone broth and organic meat and cooked vegetables and certain fruits like blueberries and pears, and taking certain herbs and peptides that reduce autoimmune disease. You can do it. Managing high blood pressure through a Mediterranean diet, more extra virgin olive oil, more pomegranates, more walnuts, more wild-caught salmon. If you follow that sort of diet, blood pressure drops, stress reduces, you lose weight, eating more magnesium-rich foods, doing these things, you can reverse high blood pressure, okay? Hormone issues like PCOS, that's like type 4 diabetes. We just have to balance insulin, okay? And so with that, we want to consider, again, going lower in your carbohydrates, getting more protein, getting more fiber, more healthy fats. It's that easy. Perimenopause. We need to eat more yin-building foods according to Chinese medicine, more organic fermented soy, more flax seeds, more sweet potatoes, more garbanzo beans known as chickpeas, so eat more hummus. I mean, there are actually certain food therapies that can actually reverse menopausal symptoms. Alleviating chronic joint pain. Today we have turmeric, boswellia, ginger, collagen, doing certain types of physical therapy. Yoga. These are more effective than long-term NSAID use, which is the 15th leading killer in our country today. Reversing fatty liver disease, doing more milk thistle, do dandelion coffee in the morning. Some really simple ways of reversing and healing most of these conditions. Here's a reality. If you rely on the pharmaceutical company to get your truth and find your truth, you'll end up dying early. You'll end up more sick. If instead you can have awareness and see through the lies, you're able to better discern the truth moving forward. And if you look to more of these natural approaches, remember, going all the way back, we talked about that Flexner Report. That's Flexner, Flexner Report. They tried to wipe out nutritionists, naturopathy, chiropractic, homeopathy, all of these holistic approaches. In fact, for in certain states, they became illegal to practice those, and those people were thrown in jail. That literally happened. Go back and read about it. It was only because they were so effective at helping people heal that people started demanding them not be illegal. The government officials eventually made them legal again. Some of these practices in some of those states where they were banned. So again, when you really know the history, I think it's so helpful in understanding the truth here. And so if you want to heal, remember, do not rely on pharmaceuticals. You have to rely on using lifestyle medicine, food is medicine, mindset medicine if you want to heal. But it's just good to be aware, because next time we have a pandemic, next time you're sitting in there in your doctor's office, you can know, well, where did you learn all the things that you learned? Oh, really, it's a pharmaceutical industry. It was for profit. So you can really understand for most of them where they're being educated, where they're learning, who's influencing them. Maybe they're making kickbacks. You can understand sort of why they do what they do. I want to say thanks so much for watching the Dr. Josh Axe Show. Remember, each and every week we're uncovering the truth, helping you grow physically, mentally, spiritually, and experiencing breakthroughs in your life. Hey, I want to let you know, the greatest thing you can do to support this show is subscribe to the show. The more subscribers we have, the more high-profile guests we can bring on. Everyone from RFK Jr. to Mark Hyman, these sort of people in the future. People, we've had Mark on the show, on my past show in the past. He's great. Again, we have so many amazing people, but when you subscribe, it's the greatest way you can support the show. So thank you, all of you, for subscribing. The second best way is by sharing this show as well. Please go online. Most people don't know about the Flexner Report. They don't know about the pharmaceutical companies having to pay out billions because they killed people. And so more people need to know this truth. So thank you for sharing on social media or text messaging to people saying, hey, listen to this. And by the way, if you share, make sure to tag myself in the show. Oftentimes we're able to repost what you share. So thank you for subscribing. Thank you for sharing. I'll see you on the next episode.